Hey everyone, and welcome back. I'm Dr. Marcos.
And I'm Dr. B. This is Michael. Today we are going to dive deeper into our in-depth history we take for every patient that walks through our door. This is one of many aspects we discussed last week regarding the Gonstead Difference, and we will spend the next few weeks going into further detail of each aspect of the Gonstead system.
As Dr. B said last week, we will take an extremely in-depth present and past history regarding not only what you came in for, but what else isn't working properly in your body.
As Dr. Marcos and I begin to dive into your case, we are taking in so many little clues that each patient gives us. Thanks to Dr. Gonstead's work and documentation, he began to see strong and significant correlations between vertebrae that were subluxated or the problem segment in your spine to symptoms that patients would present with.
The nervous system controls every function our body does, whether it's to breathe, have a heartbeat, digest, or glandular control for hormones in the endocrine system. Everything is run by the nervous system. Simply put, if a patient isn't born without something they're supposed to have, or it isn't malformed, the only other possibility is that there is a dysfunctional communication between that organ, muscle, artery, vein, to or from the brain.
Now, part of the nervous system is the autonomic nervous system. This part is what Dr. Marcos just described as the functions that don't require conscious effort at all, such as breathing, our heart beating, digestion, and so on. There are two aspects of the autonomic nervous system. The first is your sympathetic nervous system. This is also known as fight or flight, which means our system is in overdrive for protection and adrenaline is rushing through our system. We also like to think of this as our body's gas pedal. The second aspect is the parasympathetic nervous system, which is known as rest and digest. This is after a big meal and our bodies begin to be in a relaxed state, or your body's brake pedal. The human body, however, depends on these aspects to be evenly distributed for the optimal function of any organ, muscle, or blood vessel.
Now, these problems Dr. Gonstead saw were not restricted to just low back pain and neck pain, but actually quite the contrary. Due to his specificity and meticulous attention to detail, he was seeing correlations and significant positive changes in patients by uncovering clues within a patient's complaint that expressed how their autonomic nervous system was functioning. Dr. Gonstead then began to tie which nerve controlled which organ, tissue, or blood supply, which nervous system was dominant over the other, and after analyzing the patient, which mechanical dysfunction in the spine was causing the body to be in a state of severe dysfunction.
Dr. Gonstead's ability to tie all that together with his specificity and meticulous attention to detail resulted in him treating patients and getting incredibly positive changes in not only back and neck pain, but diseases such as diabetes, acid reflux, migraines, thyroid conditions, asthma, constipation, infertility, lowered immunity, heart, lung, digestion, and nearly any organ dysfunction.
And the most beautiful part of the Gonstead system is that we are never guessing due to our attention to detail and specificity. We use the history and function of your body to not only tell us what to adjust, but also what not to adjust. This allows us to have plans A through Z and have a reason behind everything we do when you come into our office, which all starts with our very focused case history.
The Gonstead system's ability to tie in every symptom or effect to the root cause of the dysfunction patients experience we learn in your case history is only one of the many aspects that create the Gonstead difference in chiropractic care.
So thank you all so much for joining us today, and we hope you enjoyed learning about why we will take such a detailed history about every patient that steps into our office. The Gonstead Chiropractic Clinic of Sarasota will have a strong plan specific to you and your needs on every single visit. We hope you have a great day, and we hope you join us next week as we dive into our instrument and why we use it.
Thank you. Bye.